Well, each state has slightly different guidelines, and each county within that state has a slightly different plan for vaccination rollout to best serve their specific population. The best way for you to find out is to check with your county's health department or your primary care provider. But please know, just because you're greater than 65 or work in public service or a teacher does not mean you will automatically get vaccinated. There are many more people in these categories than vaccines available right now, so there's still a random selection process that goes into this. Most important is you get your name on the list in the location where you are eligible, and typically that's your county health department.
This vaccine for COVID works like other vaccines. Your pharmacist or healthcare worker will inject the vaccine into the muscle of your shoulder. Your immune system recognizes the vaccine, we'll call it the antigen in this case, as something that is not supposed to be in your body and makes antibodies to fight against it. Your body retains those antibodies and remembers how to make them quickly if it ever sees that antigen again. The antibodies your body makes attack the antigen, COVID, and destroys or neutralizes the virus. The first dose is what is sometimes called a primer dose to start this process. And the second dose is a booster to help be sure your body recognizes the antigen and can respond rapidly and forcefully. Some of the vaccines nearing the market may not require that second dose or the booster dose.
While your body begins producing antibodies within 24 hours after your first dose, the maximum efficacy doesn't come into effect until 2 weeks after your second dose. However, there is good news that what we've seen in practice is the efficacy is higher after first dose than was seen in clinical trials, but still, to reach the maximum 95% efficacy comes 2 weeks after your second dose.
Some common side effects of the vaccine include some pain, redness, maybe some swelling in the arm where you got the injection. Some people might get fever, chills, tiredness, fatigue, headache, maybe muscle aches, maybe some nausea. Some patients say they just overall do not feel very well. These side effects can happen after the first or maybe after the second dose of the vaccine.
I have heard stories on the news about other states getting their doses earlier, and I also hear some about states that are way behind where we are in Kansas. The reason these discrepancies exist is because the federal government ships the vaccines to each state to secure sites, based in large part on their population. It is then up to each state to decide how to handle the distribution within the state and how to prioritize patients to receive the vaccines. In Kansas, this is a decision that the governor has made in consultation with the Secretary of the Kansas Department of Health and Environment, or KDHE. It may be that another state prioritizes patients differently, and that's why your friends were immunized before you. Our goal as healthcare providers is to get everyone vaccinated as rapidly as possible so we can return to some semblance of normal.
Patients with a history of cancer should get the vaccine. Even patients who are currently getting treatment for cancer may be vaccinated. Because the vaccine does not contain live virus, it is safe to use in patients with cancer. Patients who have a weakened immune system due to current cancer treatment might have a decreased response to the vaccine, but may still benefit from getting vaccinated. If you are currently on treatment for cancer, you will want to work with your oncologist to determine the best time to get your vaccination, such as between chemotherapy doses.
Your second dose needs to match the brand of the first dose. This shouldn't be a major issue because all patients should receive an appointment or at least a plan for their second dose from the entity that you received the first dose from. While there's no significant health consequence to this, it's rather a disruption in the continuity of care. Think of it like an antibiotic. If you're prescribed a 5-day prescription of amoxicillin, you wouldn't stop halfway through and take a different antibiotic.
My advice is to get vaccinated as soon as you possibly can. I have studied the process the drug companies went through to get the first 2 vaccines on the market, which is the same process the companies still studying their vaccines are going through. It has been fast, but companies still have to take the same steps and collect and analyze the same data. You can think of it as getting bumped to the front of the line every time a drug company has to submit information to the FDA about their COVID vaccine candidate. Those lines in normal times are months long, and the wait can be many months before they receive a response. Millions of people have already been vaccinated, and we now have a pretty good understanding of these drugs and what to expect from them. The way we combat a public health crisis like COVID-19 is to vaccinate as many people as quickly as we possibly can.
Really, this is a decision that's completely up to the patient. In my opinion, everyone should be getting the first dose as quickly as they possibly can. So in this case, I would get the vaccine as soon as you possibly can, then make arrangements for the second dose wherever you will be at that time.
Making a mRNA or messenger RNA vaccine is quite different. Here, scientists make a strand of nucleic acid, mRNA in this case, in the laboratory that serves as a pattern for a protein that is an important part of the virus. When that mRNA is injected, our body makes many copies of that one small, non-infectious part of the virus, and then it realizes that it is not supposed to be there. It then makes antibodies to the protein it just produced. While it sounds complex, it is much faster and more precise than the old method of fractionating whole viruses and using those virus parts as antigens.
Yes, patients who have already had COVID should get the vaccine. We do not know how long patients are protected from COVID-19 after infection, and since we know reinfection is possible, it is recommended that those who have been infected with COVID get vaccinated. If you have had COVID-19, you might wait to get vaccinated until 90 days after your diagnosis, but this is not required. Reinfection with the virus that causes COVID-19 is not common in the 90 days after you are first infected.
The Pfizer vaccine, which was the first to market, is a 2-dose series and should be spaced 3 weeks apart. The Moderna vaccine is also a 2-dose series and should be spaced 4 weeks apart. The most recent vaccine on the market is the Johnson & Johnson vaccine, and that is a 1-dose series.
To manage the side effects or the pain in the arm, you can apply a cool, wet washcloth to that area where you got the injection. Be sure to use that arm that was vaccinated also. You want to make sure to drink plenty of fluids and stay hydrated. You can take ibuprofen, naproxen, or acetaminophen for any pain or discomfort that you have after getting vaccinated, as long as you do not have any medical conditions that prevent you from taking these medications normally. You may also want to clear your calendar for a day or two after you get the vaccine to allow yourself plenty of opportunity to rest in case you do experience any side effects.